So this is Dr. Maas on Looking Your Best, and we're having a patient who has obviously a cleft lip deformity. Unfortunately, this patient has an area that you can see on his chin here, which is relatively hairless, and the X marks where we're not treating. So each one of these little squares, and if we could get a little closer, I would show you. It has, with 1 centimeter, we can get approximately 20 to 25 grafts per centimeter. And if I pan up here to his upper lip, which is really his main concern, you can see in this central zone where he's basically hairless, we're going to be able to really get his density up. And the hope is to, if I back this out a little bit, he has the sort of common fear, the beard, large beard, but he would look much better with disguising the cleft if he had a little bit shorter hair, cut in a more standard goatee, but can't do that currently because he has this whole central section of hairlessness. So as we close his donor site behind the head, I'm going to do probably between 500 and 600 grafts between the upper and lower lip. And then if you lean him back just a little bit, his head's too far forward right now. Just lean his head back where I had it. It's about a 45. Yeah, so as we look at these sections, up tight, you can see that we really are in the neighborhood, and you can dab that a little bit if you want. We're in the neighborhood of about 30 grafts per centimeter as it stands now. These little slits will widen slightly with our techs who are really, really good. They don't like us to do the methylene blue painting, which sometimes we'll do, as these little slits will open up, and it makes delivery of the hair follicle and the hair, the little up to 2 millimeter hair handle, so we can orient the hair as we plant in the upper lower lip. The X'd out area, we won't have hair growing. And in the central lower lip, if you can lift his lower lip up for me, just from above, with a finger, turn his head toward me slightly. Should be facing the camera, if you will. And, you can see that central area that's not marked out with X's will have many hairs, and that's really the main area where we're targeting in the lower lip, as well as getting the density in the below the X's on both sides here. So the macro view, you can let go now there, thank you. The macro view is to really disguise the cleft lip palate and then let him have more options with hair growth, with beard and mustache hair grafting. So this is Dr. Maas on Looking Your Best. This is beard and mustache hair grafting. So I'm doing a running, and we'll use very commonly a 3O polypropylene suture, and this is a running, non-interlocking, but because he has a short hairstyle and he has dark hair, I am doing this with, and it's really, you can see just a millimeter from the wound edge, and I'm doing this with the black nylon. That way we don't have to worry about any visibility of this. And for our 500 grafts, we've estimated on his density, hair density ranges between 60 and 80 hairs per centimeter, 1.5 centimeters width of the incision we typically use. So we can then guesstimate if we're going to need about 500 grafts, we're going to take 6 centimeters roughly with a little Burroughs triangle at each end. And then if we get the nice closure, we've got a great head start with our hair techs in the next room, working under the microscope and cutting as we do the closure. And I can tell you, I've never, can we dab please? We've never had to revise this in our practice. I've revised linear incisions, but for people who describe a linear strip incision scar as being something that's unfavorable, I would just say it's rare, even with very short haircuts, that you can see any of the scar. And that's why we're so careful to evert these skin edges, which is why these sutures are key. And occasionally we'll do a running interlocking suture just to secure the eversion and then continue with the runner. And I'll often put a couple of interrupteds in too at the end, and if they were to have a suture, a knot go awry, then on the runner, then we would be okay for not having to, do emergency closure on them. But you can see, whether we're looking close up or far away, that this is a very clean and a very effective way of closing, rather than having 500 1 millimeter, little punch holes there. And that's about the extreme of where I would do a suture. What I just did, I would typically keep it at 1 millimeter from each skin edge.